So if you're watching this, you've had a breast augmentation and it's the first week post-op, the first night. So what should you expect? Well, you're gonna have some discomfort. It's mostly gonna feel like pressure on your chest. And so that's typical, that's normal. The swelling should be pretty equal in each side, and then one side shouldn't hurt dramatically more than the other side, but sometimes there's a little more discomfort in one side than the other. That's normal. Dramatic difference in discomfort, we need a phone call about that. And dramatic swelling in one side versus the other, we need a phone call about that. That could be a sign of early bleeding. And so let us know right away. Otherwise, it should just kind of feel like an elephant sitting on your chest, and that should improve as long as you're stretching your chest muscles. That's what's making that discomfort and that pressure be there. So make sure you're doing your exercises, stretching your arms. Our nurses will have given you instructions regarding that. So make sure you're doing those, because that's going to help a lot in that first post-operative day. Most patients don't take much pain medicine past that first night, and some don't even take any that first night, and you're certainly not required to. The anti-nausea medicine is similar. Most patients don't get real nauseated after a breast augmentation. Pain medicine can make you nauseated, so if you're taking the pain medicine, make sure you're taking it with some food. The anti-nausea medicine should be able to help you with that if you do get nauseated after that. You will be given an antibiotic during surgery and after surgery. We want you to take that antibiotic as prescribed. It'll be for 3 days after surgery. Usually after the first day, after your first post-operative night, things become much easier. My strong suggestion for you after that first night is you get up in the morning and you stretch. You're gonna find that that sleep you had that night made things worse, not better. And so don't be panicked by that. You're gonna feel tighter, sorer, and unable to move your arms. The best thing to do is to take everything off, get in a nice warm shower and stretch in that shower. Stay in there for a half an hour, stretch in the warm water. The warm water can run on your breast, that's totally fine. You'll be amazed what a difference that makes for you. How much your breast muscles will relax, how much better your breasts feel, how much better you're able to move your arms. And most patients are able to be off pain medicine after that time. Put your bras back on, put some gauze over your incision, and then go out and do your day. Some things like going shopping and trying on blouses, even though that sounds crazy right after surgery, is helpful because it helps you stretch your arms and keep your arms moving. If you're off pain medicine, you can drive a car. Be careful that you're not exercising or working in those first 3 days or first 3 weeks after surgery. You can go to work, but not work out, not do anything strenuous, not do any heavy lifting, certainly not lift weights. No pools, jacuzzis, or submerging in water in those first 3 weeks after surgery. After that time, you can start working out, and that's perfectly appropriate. We're gonna see you back in clinic, typically in the first few days after surgery, and then again at week 3 or 4, right around there. You're gonna come back to see us at week 3 or 4. We're gonna remove most all of your restrictions at that point, except for working out with your chest. We're gonna often tell you not to work out your chest muscles afterwards, depending on how your implant positioning looks. You're gonna go home with a bra right in the beginning, and you may go home with a band over your breasts, most commonly not, but possibly. When you come back to see us on the first post-operative day or at week 4, we may give you a band at that point to try and help accelerate your implant settling. That settling process can sometimes take many months, so don't worry if your implants aren't settled right away. Also, don't worry if they don't settle at the same time, because they usually don't. Often one side will settle much sooner than the other side. Don't wear push-up bras or underwire bras until we discuss that with you. But otherwise, live pretty normal, go back to work, and enjoy your new breast augmentation.